Care home visits are really important to reunite care home residents with their families and help maintain their health and well-being. To help lower the risk of COVID-19 transmission during visits, new rapid tests are being introduced for care home visitors, giving you extra peace of mind when visiting your loved ones. Lateral flow device testing is one of the quickest coronavirus tests available. This technology can achieve results in just 30 minutes without the need to go through a laboratory. In care homes, these tests can be used to identify people who are most likely to spread the virus and help protect care home residents. As many as 1 in 3 people who have coronavirus have no symptoms and will be spreading it without realizing it. This type of test is able to detect the virus in people who aren't showing any symptoms but could still pass it on to others. It's really important, though, to understand that taking a test does not make visiting completely risk-free, so it's still essential that you follow any instructions, called infection prevention and control measures, from the care home staff. And it's essential that you use the right PPE at all times and keep it on. You should also keep physical contact with the person you're visiting to a minimum. Taking care to follow all these steps is the best way to keep the person you're visiting and all the other residents and staff in the care home protected from the risk of COVID. I'm now going to show you how to prepare for your test. Each time you visit a care home, you'll be asked to take a rapid test when you arrive to check if you might be carrying COVID-19. You'll be asked to carry out the test and do a throat and nose swab yourself, supervised by trained staff. You'll receive your results within 30 minutes. You'll need to register your test results online. To do this, you'll need your home address, contact details, including mobile number and email address, and NHS number if you have it. If you don't have a mobile number, bring along the telephone number of a relative or a friend who could receive your test result. If you don't have a relative or friend's number, let a member of staff know, and they'll help you register your test results. Please also remember to bring a face covering with you. A staff member will provide personal protective equipment, PPE, including gloves, mask and apron. You'll be asked to sign a consent form to confirm that you agree to taking the test and sharing your result. A staff member will check you in for your visit. After you check in for your test, a member of staff will direct you to move to the testing area. Next, you'll be given a swab inside a sealed wrapper. You'll need to take your own throat and nose swab, supervised by a member of staff. Don't worry, they'll explain how to do this step by step. Once you've swabbed your throat and nose, you'll be asked to give the swab back to the member of staff. You'll then be asked to wait in a designated area until your result is ready. This will take approximately 30 minutes. After 30 minutes, a staff member will tell you your result. Once you've received your result, you'll need to register your test kit online with your own mobile device. If you don't have a mobile phone, you'll be provided with a device you can use. A member of staff can also help you if you're not able to register your own result. Your test result will determine whether you can complete your visit. If your test is positive, you won't be able to visit. You'll have to take a second, slightly different test that the care home will provide for you. Once you've taken this test and registered it, you'll need to go home immediately and self-isolate until you receive your result. NHS Test and Trace will text, email or call you with your result in around 72 hours. If you test positive, NHS Test and Trace may contact you to ask about people that you have been in contact with. If your test result is invalid, the care home will ask that you take another lateral flow device test. If the second test also comes back as invalid, the care home will explain which type of visit, if any, might still be possible. If your test result is negative, your visit can go ahead. It is important to recognise that a negative test will provide some reassurance. However, it's not a guarantee. To keep your loved ones and other care home residents safe, you will still need to follow protective measures and wear PPE at all times. The result of your test will also be reported to the main NHS Test and Trace programme. NHS Test and Trace will send you either a text message or an email with your results on the same day. Holding hands and personal contact are allowed if you've had a negative test result and are wearing PPE, but visitors should minimise contact as much as possible to reduce the risk of transmission. Bringing along food for the resident is also allowed. Visits can take place in the resident's room or another room that the care home has set aside for visiting. Before you visit, you can find out more guidance on care home visits on the gov.uk website.